The hospital has been an amazing place to work.
The community itself is very warm and very welcoming.
This is a pretty great place to work. There's just so much that this community can offer.
It really does feel like home.
This town offers so much to us. We have Arrowhead Park just to the north. We have Hidden Valley Ski Area.
I mean, you have Algonquin Park at your doorstep.
Downhill skiing, we cross-country ski, we snowshoe.
Hiking, canoe tripping, animal viewing.
If you like driving without stopping, if you like looking at trees instead of buildings.
Tons of golf if you're a golfer, good tennis clubs.
We have a new sportsplex in town.
Pools, sports teams, organized leagues.
I compare notes with my colleagues and friends in the city, and they have to drive up somewhere decent to get a ride in. I just pop right out my door.
It's simply stunning, it's beautiful. We live amongst the pines and lakes and rocks and trees, and there really isn't a more scenic place in all of Ontario to be.
I first came here because I wanted to live close to the hospital, but still in the woods and on a lake. One of the fun aspects of working in a small town, and a town, frankly, that's not too small, is that you get to practice your scope of practice, a broad range of activities.
Living in a more rural setting really doesn't put any barriers that might have been there years ago. You get to do things maybe in a larger center that would be segmented into different scopes of practice.
You know, you get to see everything at every level.
We tend to be a bit of jack of all trades. We don't specialize in one area or another.
You'd be surprised how often you do see totally unpredictable, challenging diagnoses that are very satisfying to make.
We see a wide array of patients. We help out down in the emerge department with traumas and the very sick patients. And then we also, here as ICU nurses anyway, we have the ability to go out on transport.
Working in a rural area does give you a very broad spectrum of your practice. You get to do almost everything. You get to do it yourself, not only yourself, but you also get to do it in large numbers.
Our proximity to referral centers is pretty close as well. I mean, Aurelia and Barrie aren't that far away.
We do a variety of treatments here, including chemotherapy, but also some other supportive treatments.
Family physician here, if they wish, can provide procedural sedation and anesthesia,
bladder cancer treatments,
emergency room backup services,
blood transfusions,
assisting in the operating rooms,
IVIG, iron infusions,
doing orphan on call, working in long-term care, doing obstetrical.
But because there is a need in these specialized areas, it's a grow your own approach.
It's a marvelous town, very active, very progressive.
A lively and vibrant arts community, a beautiful new Algonquin theatre.
Our beautiful downtown, our bakeries, our coffee shops.
Nice restaurants.
The lakes, the rivers, the trees.
We have brand new ice surfaces.
Very active churches in the community.
When it comes to living here, we settled here. We thought, my wife and I, who's also a doctor in the community, and we thought, why wouldn't we settle in an area where we always come up to play and enjoy ourselves?
I was born and raised, actually born in the Huntsville District Memorial Hospital. There's nothing like walking into the doors of either the South Muskoka site or the Huntsville site. It really does feel like home. You have people that truly, genuinely care who you are.
For us, Muskoka fit the bill. We had lived in Toronto and in Ottawa. We're outdoorsy people, and you know, if you want to go for a mountain bike ride in Toronto, other than the Don Valley, you have to drive for an hour.
I started my practice in Gravenhurst fresh out of residency. I really love working in a rural area. Some people believe that it's not as secure because you don't have all of the specialists and subspecialists right at your fingertips. But we are very well supported by our specialists in our community, as well as the specialists in surrounding communities of Aurelia, Huntsville, and Barrie.
The hospital, for me, has been just an amazing place to work. I've been able to practice up to the entire scope of my RN.
I think we're extremely lucky to have an opportunity to be able to work in a community as beautiful as this, and with such great community support, and with such a fantastic hospital.
When moving back to Ontario, we decided we had to pick a place that would live up to living in BC for 3 years.
There are umpteen clubs that you can belong to in this town.
Our Tom Thompson and the theater, and our wonderful new Summit Center.
You think a small town can be boring and a little dull, not quite as much choice as you'd like. I think Muskoka takes care of that without any difficulty. Raising children here in Muskoka and Huntsville in particular has been great fun.
The Ontario government runs a lot of programs in the early years, so that's always available to go to in the morning.
There's public education, Catholic, French immersion, Christian, Montessori.
Our teachers are Montessori trained. What's different about a Montessori classroom is that we have what are called 3-year age groupings. So the lessons are very much geared one-on-one. From the age of 3 through grade 8, all of the children know each other, the families all know each other. It's really a very warm and lovely community that we have.
My son was 3 years old when we moved here, and it was a wonderful place to relocate.
Teaching at Tungo College is not just about the teaching day. It's a way of life. A math lesson under a tree, being able to read a book by a stream, it enhances their sense of awareness of nature and also their academic success to an incredible degree.
If you want to know the educational system, as far as I'm concerned, is fantastic.
I'm a grade 8 teacher at Spruce Glen Public School. Our focus on character education is really high, and we have a lot of great things going on here. It's part of my job to really teach the kids how to be there for each other.
Not only did I want to teach here, but I want my kids to go to school here. This high school offers everything a kid could want, from a fantastic music program to the most extensive athletic program I think I've ever seen in a high school.
One of the most impressive things about this hospital in particular was the very welcoming and supportive volunteer workforce that's here.
We have a very, very active volunteer group in the hospital, and they raise a lot of money for the hospital.
Our community is very vigorous in finding ways to get the funds to pay for what we need.
More than most hospitals at twice the size are getting on a regular basis.
We have money coming in for a lot of projects that other hospitals just can't raise.
We are being told more and more that we've got to make cuts everywhere, and if it were not for the foundation, we would not be getting half the equipment we have right now.
Part of the reason that we have the hospital we have is entirely on the foundation.
We have some of the finest equipment you can get.
Good bronchoscopy equipment.
Laparoscopic, endoscopic equipment.
We are up to date as far as our emerge department.
Fantastic pulmonary function equipment.
X-rays, ultrasounds, CT scans, mammograms. You don't get to see these kind of equipment in a very big hospitals.
It has allowed us to stay at the forefront of minimally invasive procedures.
7+ years ago, the community got involved with the Northern Ontario School of Medicine. We have students in our community studying their third year right here in the community.
The work environment here is excellent. Not only the physicians, but also the nurses and the rest of the healthcare professionals. And definitely a group that I'd like to come back and work with eventually.
Everyone's very approachable and works very well in a team environment, which is certainly always appreciated as a resident.
Seeing the students come here and spend several months getting more education and working with the medical community in Bracebridge, and we want to see that progress and grow.
This will be my first and last community in which I practice medicine.
I love the staff I work with. The nurses are so experienced and professional and fun to work with. We really have a good time, and that's one of the main things that keeps me working here.
The collegiality of the staff here is bar none.
Honestly, there isn't anybody I work with here that I don't like and admire.
The people I work with, I think, are exceptional. Most of them come and they stay.
The people keep me at MAHC, and you know that there's such a kind, caring, compassionate group here.
I don't see any good reason anybody wouldn't want to come to Muskoka.
If it wasn't for the fact that we needed another general internist here, I'd be hesitant to advertise this place because I'd like to keep it to ourselves.
I couldn't imagine living anywhere else.
You're actually living in a paradise and working in a paradise.
I feel respected. I feel I'm valued.